This is the weekly Health Law News Nugget from Southern Health Lawyers. I'm Rich Sanders.
And this is the Health Law News Nugget for July 10th, 2018. Well, it was another big weekend in Washington for the Trump administration as the administration announced on Monday of this week, so July 9th, that CMS had suspended payments under a controversial program called the Risk Corridor. Under the PACA, the Patient Protection and Affordable Care Act of 2010, the federal government had basically a pool of money set aside to assist health insurance companies that were selling policies on the federal insurance exchanges, whether they're operated by the states or through CMS, to help shore up losses that health insurance companies experienced as a result of selling policies on those exchanges. This set up an infrastructure where health insurance companies would, on the basis of their annual performance, submit requests for compensation under the Risk Corridor program to CMS on an annual basis. And as those of you who've watched the News Nugget on a regular basis know, health insurance companies regularly claim that they're losing money hand over fist on the insurance exchanges and require this additional support. In the news, you see this concept described as health insurance market stabilization. Well, the stabilization took what many are considering a big hit this past weekend when CMS determined that as a result of a ruling in New Mexico that it was suspending all payments under the Risk Corridor program for the foreseeable future. The president said that this is a step in the right direction, that the health insurance companies need to stabilize themselves. And Seema Verma, the CMS administrator, said in a press release over the weekend that basically this suspension of payments under the Risk Corridor program meant that for the year 2017, through which these payments were due to health insurance companies participating on the exchange, that a total of $10.4 billion were being held up. Now, it's unclear as a result of these press releases and announcements from the administration what it's going to take to get the Risk Corridor payments off hold and whether there's any foreseeable future for health insurance companies to receive these payments. But commentators over the weekend and on Monday were quick to point out that this is just going to destabilize the health insurance markets and potentially drive up costs for 2019 when health insurance companies are trying to sort out what those rates are going to look like for consumers. So yet another busy, as often is the case in this day and age, controversial weekend for health insurance and the process of reforming our healthcare reform system in the United States. Thanks so much for watching the Health Law News Nugget this week. I'm Rich Sanders with Southern Health Lawyers. Thanks a lot and have a great week.